Good afternoon, everyone. Stand by for Health Director Gibbie Harris.
Good afternoon, and thank you for attending this afternoon and helping us get the message out to the community. I'm going to start with a brief update on data. As you know, our twice a week data report came out today. The good news is we're averaging 782 cases per day, which is a decrease over last week. And our percent positivity rate is running 12.4% average, which is a decrease over last week. Unfortunately, our hospitalizations are at 540 average per day, which is an increase over last week. So it's a little bit of a mixed situation for us. The numbers seem to be, in most cases, trending in the right direction. But again, those numbers are somewhat fluid, and so we're watching this all very closely. As I speak about hospitalizations, I want to let you know that Mecklenburg County experienced the second pediatric death related to COVID in the state of North Carolina since the beginning of the pandemic. We are saddened by this situation and extend our deepest sympathy to the family. We are not providing any additional information about the individual as we work with the family to help them through this difficult time. I also wanted to speak briefly about the issue of the directive, the intent of the directive, and a lot of the concerns that we've gotten from individuals in the community around sports and the impact that the directive is having on sports. Again, the directive was meant to encourage everyone to stay at home except for absolutely necessary activities. The intent behind this was to limit people's exposure of any kind throughout the 3 weeks, and hopefully to help bring our numbers down so that we can get to the place that everything that needs to be open and wants to be open will have a better opportunity to do that. Sports is no different than any other activity that we're talking about during this time. Our schools are closed. Many of our businesses have slowed down or closed. And so as we understand the concern about sports, I'd love for sports to be up and running, but I'd also really love for our schools to be up and running. Our children need that. So again, this is a short 3 weeks that we have hoped will have an impact on our community in terms of improving our COVID situation. We need everyone to support this request and the requests that are in the directive. And I appreciate all of what I'm hearing from individuals as they attempt to do that. And now I will turn it over to Dr. Meg Sullivan to give us an update on where we are with vaccine.
Thank you, Gibbie, and good afternoon, everyone. As Gibbie mentioned, I'm going to again provide a brief update around vaccination distribution by Mecklenburg County Public Health. So as always, I'm going to start with some quick numbers. As of yesterday evening, we have administered approximately 7,885 doses of the Pfizer vaccine, about 7,516 first doses, and 369 second doses. And again, have another busy schedule today for vaccine distribution for both first doses and second doses at Bojangles Coliseum and at unenrolled long-term care facility sites in the community. We will be receiving 2 additional shipments of first doses of vaccine today, which will include 1,950 doses of the Pfizer vaccine and 800 doses of the Moderna vaccine. This is our first shipment to the Moderna vaccine, and we will be working to distribute these doses in addition to the Pfizer doses this week. We continue to vaccinate individuals in groups 1 and groups 2 as per current North Carolina Department of Health and Human Services prioritization guidance. And as a reminder, group 1 includes healthcare workers with current in-person patient contact and long-term care facility residents and staff. And group 2 includes older adults, which is individuals ages 65 and older, regardless of health status or living situation. We are excited to announce today that we will be opening additional appointments for the first 3 weeks of February for groups 1 and group 2 eligible individuals based on anticipated vaccine supply that we will receive. Appointments will be available for scheduling beginning Thursday, January 21st at 8:30 a.m. This will allow us time to disseminate this information related to new appointment availability throughout our entire community, and we really appreciate everyone's help with sharing this information widely. Instructions for making appointments are available on our website, mecnc.gov/COVID-19. And when these appointments open up, eligible Group 1 and Group 2 members may make their first dose appointment either online using the link provided on our website or via phone by calling our hotline 980-314-9400 and selecting option 3. I want to stress again that these February appointments will not be available to schedule until January 21st at 8:30 a.m., and our hotline staff will not be able to schedule the appointments earlier than this date. Residents who are unable to secure an appointment are encouraged to continue to check back for updates. So we know as more vaccines become available, additional appointment times will be made available as well. We will continue to update our website and widely disseminate this communication. We also want to encourage residents age 65 and older to reach out to their primary care providers if available to discuss options, to remind that Atrium and Novant Health are offering vaccines to eligible patients in Groups 1 and Group 2 by appointment as well. Mecklenburg County Public Health, we continue to work directly with community partners to prioritize vaccine availability among our communities most disproportionately impacted by the COVID pandemic, including specifically communities of color. This includes through specific outreach through community leaders, through community-based organizations and intentional media campaigns, as well as through appointments at Bojangles and through vaccinations in the community setting. Throughout our entire vaccination distribution planning and response, equitable distribution in our community has been and will continue to be a central focus for our efforts. And finally, as always, we remain committed to delivering vaccine as quickly and equitably as possible in our community, but also take every opportunity to remind everyone that we continue to have a large amount of COVID in our community and that we all have a responsibility to continue to follow all public health guidance to prevent further spread. Thank you.
All right, first question today is Chandler Morgan, WBTV.
Hi, I just want to make sure you can hear me first.
We can.
Great, thank you. My question is about teachers and specifically the plans with CMS. With Group 3 next in line, what is the plan that's been developed with Mecklenburg County Public Health as far as, is there going to be a plan to possibly vaccinate CMS teachers? What does that look like? And then there's been a lot of questions exactly how CMS teachers who live in, let's say, a South Carolina county or Union County, but they work in CMS, is there a way that they can have clarification as to can they get vaccinated in Mecklenburg County because they work here?
Those are great questions. And I know that we have lots of people in Group 3 who are very interested in being vaccinated right now. We're getting lots of input around that. Unfortunately, we know we still have a lot of people in Groups 1 and 2 that have not been vaccinated yet. So we don't have a specific timeline for vaccinating in Group 3, but we are working on our plans for what that will look like when it becomes available. As we have always asked people to be vaccinated in their home county, if that's at all possible. We also know that this is a federal program with federal vaccine, and from that perspective, there really are no jurisdictions. So if someone comes to us from another county, especially if they work in Mecklenburg, we'll definitely vaccinate them.
Next question is Caroline Hicks, WBTV.
Hi, in terms of being able to expand to ages 65 and up, can you just talk about how you guys now are able to shift to that and how many appointments you are hoping to be able to open in those first 3 weeks of February?
Yeah, it's a great question. I think, as we said, we're making appointments available based on anticipated vaccine supply, but we still don't know. We are still learning from week to week how much vaccine we will supply. And so we're making those hard decisions about how many appointments to make available, again, based on anticipation, but we won't have that specific information available. So we are planning on making about 1,500 appointments available each week. And then with the hopes that if vaccine becomes more available, we can then open up additional appointments. But that is our plan for 1,500 appointments a week about for the first 3 weeks.
And being able to open those appointments, is that because you got more allotment this week?
So it's not based on our allotment this week. The allotment that we got this week that we will be receiving today, we will be administering within the next 7 days, but in anticipation of receiving another allotment next week. I think it is just based on the allotments that we have been giving. We also know that we want to make appointments as available as possible. And so I think we anticipate being able to provide at least that number of amount of vaccine at the beginning of February. Again, recognizing that information is fluid, and as more information becomes available, we will share it.
Next question is Chloe Leschner, WCNC.
Hi, thanks so much for doing this. This may be a little repetitive from what was just asked, but it seems like you all did get a larger allotment this week. Are you expecting them to grow each week, especially maybe now with the new administration on the federal level? And then do you have any idea how far appointments will be booked out for this group 1 and group 2?
Yeah, so I think I can answer that we are very hopeful that allotments will grow, both for the health department as well as in the county, as well as the state and the country, but we do not have any definitive information right now. Again, we know what we're getting this week. We do not know at this time what we're getting next week or the weeks after, but we remain hopeful and we remain in constant communication with the state about that. At this time, we are booking appointments beginning February 1st for 3 weeks, so through February 20th. And then as more information becomes available, we will promptly communicate it and hope to make more appointments available as well.
Next question is Claire Donnelly, WFAE.
Hi there, Claire Donnelly from WFAE. Thanks so much for doing this. With that pediatric death, are you able to share how old they were and whether they had underlying health conditions?
As I mentioned earlier, we are not sharing any specifics about the individual at this point in time to preserve the privacy of the family. Suffice it to say that this was someone under the ages of 18, and that is not a good situation regardless of the age or whether they had an underlying health condition or not. We do not want to see anyone under the age of 18 dying from COVID, which is preventable. And as Dr. Sullivan mentioned earlier, we need people to do the things that they know will help prevent this in our community. And that's what we're staying focused on. So I cannot provide any additional information, but please know that this is not an acceptable situation for Mecklenburg County. And we need to continue to stay focused on how we can prevent it from happening again.
Next question, Derek Dellinger, Fox 46.
Thank you for taking my question. We've heard from a number of people who have said that they've tried to call in to the health department, or at least tried to get their vaccination scheduled, appointment scheduled, and they have not been able to schedule that, mainly either due to the overload of people that are already coming in or things of that nature, especially with the limited vaccine that you have. What would you say to those people, and how are you addressing those situations with a bunch of people wanting this vaccine? And I would imagine there would probably be a lot of phone calls about that too. How are you addressing all of that?
Yeah, I think it's a really hard question because when you said, what would we say? I think we understand the kind of anxiety and frustration around the vaccination supply. We are living it every day, and our goal is to get as much vaccine as possible out in our community and eventually to vaccinate every single person in this community who is eligible. And I think I can say with 100% confidence that our staff is really working around the clock and trying to do everything we can to be as responsive to the community as possible, to answer every phone call that we can, to return every voicemail and email that we can. But we also recognize that the number of calls is very large, that there is more demand for the vaccine in the community than supply, and it makes it challenging for everyone. So we do continue to work. Again, we're excited about these appointments that we're opening up, but we fully recognize that we will not be able to provide an appointment for everybody who is eligible. And that's challenging. And I think, we want to make vaccine, as vaccine comes, we want to get it out as quickly as possible, but also continue to work with the state, continue to work with the federal government, continue to work with our community so that we can really try and make sure that we really do provide vaccine in an equitable way and get it out as quickly as possible. So again, we know appointments will be available on Thursday. We will have a lot of hotline staff ready to answer calls. We will answer as many as possible. We will return voicemails, but we also really appreciate everyone's patience, everyone's understanding, because we're all in this together and really just trying to get vaccine out.
I want to reiterate what Dr. Sullivan's just said. Is patience is sort of the key word right now. We're trying to be patient. We're finding it very difficult. But I also want to let folks know that the estimate of the number of individuals in our community between the ages of 65 and 74 is about 80,000 people. That's a lot of people to vaccinate when you're getting 1,950 doses a week. So again, we ask for your patience, and we will do everything we can to advocate with the state for more vaccine, working with both of our hospital systems to make sure we're getting as much vaccine into Mecklenburg County as we possibly can, and then getting it out to the population that's prioritized at this point in time.
Next question is Allison Kuznets, Charlotte Observer.
Hey, Gibbie, it's Allison from The Observer. Could you talk a little more about the positivity rate decreasing? Would you say that means that the virus is less prevalent in Mecklenburg, or is that because maybe not as many people are getting tested compared to Thanksgiving and Christmas? And can you also share, if the positivity rate is decreasing, would you expect to see the hospitalizations start to decrease soon as well?
That's a great question. I would like to think that this decrease in our positivity rate is a move in the right direction. But as I said, we do know that over the last couple of days, that positivity rate for some of our major testers has gone back up a little bit. So we're going to have to watch that very carefully. I'd like to think that it means that people are being a little less active in the community and we're seeing less spread. But again, we're just going to have to watch it carefully to see how this plays out over the next couple of weeks. And as you know, we've talked about hospitalizations lagging a little bit behind the number of high cases. And so that what we're seeing in our hospitals right now is not completely unexpected. Over time, we would like to see a decrease in hospitalizations, but the models that our hospitals have been using are showing that not happening until the first week or two of February. So again, all of these numbers continue to be somewhat fluid, and we just have to watch and continue to do the things that we know are going to prevent the spread of the virus in our community.
And just to double check, so that would mean the peak right now that you're seeing or the hospitals are seeing is that first or second week of February?
That the last piece of information we got from the hospitals on their modeling is that they were expecting to see a peak in the first couple of weeks of February for hospitalizations. Again, that information is at least a week old, so it could be changing some. But so we don't expect hospitalizations to drop dramatically anytime soon. I think we've got to continue to watch that. And our numbers, yes, our cases are down to 782 per day. That's not quite 100 cases per day. So our numbers are still significantly high, and we need to pay attention to that.
Next question is Brett Jensen, WBT.
Thanks as always for doing this, guys. Real quick, one quick clarification and then a question. The clarification about the 65 to 74 being roughly around 80,000. Is that just people that you have to vaccinate, like the 20,000 that were 75 and older, or is that like a population that CVS will help take care of in Atrium and Novant as well?
That's a total for the county. So obviously some of those may be in long-term care facilities, and CVS and Walgreens will help take care of some of those, although we're doing some of those as well through the health department. But those are also individuals that will be vaccinated through both of our hospital systems as well as the health department. So that's the total number for Mecklenburg County.
Okay, great. So the question, and I know this is a random question, I literally just got off interviewing Hornets president Fred Whitfield, and we were talking about this, and I asked him specifically about opening things up and when he expects, and and talking with you, and he said he's hopeful that after the All-Star break, the second half of the season, is that hopefully when things will start being able to loosen up a little bit, at least here in Charlotte, in terms of the allowing some fans, however many, 5%, 10%, whatever, going to the games. How often are you guys talking to the Hornets specifically, since they are the only game in town right now, about when that day might come?
We have regular check-ins. I won't say they're weekly, but just regular check-ins to see where things are and to talk through possibilities. And the one word you used was hope. I think we all have hope right now that things are going to improve as we move into the early spring and into the summer. And so I would love to see fans in the arena for those games. I'd love to see our kids back in school, and I hope to see sports back up and running, as I know many of our parents and students would love to see, as well as individuals who just like to watch sports. So, the word here is hope, but it's also prevention, and we need people to do the things that are going to help us get to those places. I just want to continue to reemphasize that as much as I can.
With the Panthers, it was, the fact that we had just gotten down to right around 5%, 6% positivity rate. Just in a ballpark figure, is that where you would like to see it before you even start really having serious discussions about fans at the Spectrum Center?
That's what we'd like to see. Whether we would consider it sooner than that will just depend on the situation in the county. And again, numbers that they're talking about, sometimes if they're just talking about family members attending games, we'll just have to have those conversations as we move forward. But again, the lower numbers that we were seeing back in the fall did make a difference in terms of the work that we did with the Panthers, and would do the same thing with the Hornets.
Next question is Katie Peralta, Charlotte Agenda.
Hey everyone, thanks for doing this. Quick question. Now, correct me if I'm wrong, but we saw a little bit of discussion about this in other counties. Can you confirm that individuals can get a vaccine through Mecklenburg County, even if they do not reside in Mecklenburg County?
Yeah, that has been a huge conversation in the state and among counties, as individuals want to make sure in their communities that the people that are getting vaccinated are in the community. And that's an emphasis for us here. We would prefer that our vaccine is going to Mecklenburg County residents. But as I mentioned earlier, this is a federal program. The federal government is providing all of the vaccine to the states, who is providing it to the local counties free of charge. And because of that, the federal government does not respect any jurisdictions. And so individuals are able to get vaccine where they're able to get it. Again, if we can encourage people to be vaccinated in their home counties, we'll do that. But the other thing to recognize is you should be getting your second dose from the same place you got your first dose. So we've had some individuals from Florida who would like to get their second dose here. That is really not a viable situation for us, because we're only getting second doses for people who got vaccinated through us with their first dose. So I want to be clear about that. But again, we are not turning people away who are coming in for vaccinations if they're in our group priorities, and will not do that.
Okay, the floor is now open for follow-up questions.
Hi, Gibbie. This is Hannah Smith with The Observer. Can you talk a little bit about when we might expect to see some difference from these vaccinations? Is there a certain percentage, a certain threshold of people vaccinated that you're looking for when we might start to see some sort of positive thing from these vaccinations?
Yes, but that percentage is a long way off right now, unfortunately, based on the amount of vaccine we're getting. I mean, the projections are anywhere from 65 to 85% of our population needs to be vaccinated. And as I mentioned earlier, if all we're getting is for Mecklenburg County Health Department, 1,950 doses, and our hospitals are getting more doses than that, but still not a huge number, then it's going to be a while before we get that percentage vaccinated in our community. So again, just continuing to emphasize the fact that we need to wear masks, socially distance, not be out and about if we don't need to be, and maintain those prevention measures in our community right now.
Gibbie, this is Eric Spanberg with the Business Journal. I had two questions for you. The first is, with the slight improvement you mentioned on those trends, does that reflect yet anything that's happened with the directive, or is it too soon for that? And then secondly, what are you hearing in terms of the business response and reaction to your directive, in terms of whether people are following it and trying to limit capacity?
Those are great questions. I think it is probably too early to see any major shift based on the directive. We would expect to hopefully see something next week. I would imagine some of these decreases may be related to the fact that we are several weeks out from the holidays. So we'll continue to watch that. And in terms of the businesses, We've heard of a number of businesses who have slowed down their business. Some have actually decided to close for a little while. I've not heard a lot from the business community at this point, but I appreciate all of the efforts that have been implemented while the directive is in place.
Thank you.
Gibbie, this is Chandler Morgan from WBTV. This is a very specific example, but with schools now closed for the next 3 weeks, a lot of families are turning to either in-home tutors or someone who works as a nanny or just a way to kind of watch your kids for supplementary. How does the vaccine work for them? Which category do they fall into? Is there a way that families can work with the health department to try and get something signed so that they would be qualifying as a teacher? I guess, how does that really work?
At this point, I would say they probably do not fall into any of the initial groups, and they probably would not fall into group 3 even. I'm looking at most of those individuals, unless they're 65 or older, 65 and under with a chronic condition, probably won't fall into any of the groups until we get to the final group at this point in time. Now, as you have seen over the past several months, the guidance continues to evolve, so that could change with time, but right now they do not fall into group 3. And as I mentioned earlier, we still have a lot of people to vaccinate in groups 1 and 2. So we're not sure how quickly we'll get to group 3 unless we get a huge bolus and the amount of vaccine that's coming regularly into Mecklenburg County.
This is Fred Jensen with VPT again. Gibbie, I'm curious. I asked you and Dr. Sullivan, I guess like three weeks ago when this all first started coming out with the vaccine, or actually back in December, I should say, about trying to convince people to get the shot, and the skepticism rate was high. And all the data and all the polling has shown that the skepticism rate has really started to go down, and more people are doing it, even when they might have been first skeptical. But all the same data shows that people in minority communities and poorer communities are still very, very skeptical. Are you still seeing that here locally?
I think to some extent we continue to see that. A number of our conversations with community partners that are either from those communities or work with those communities are telling us the same thing. We're continuing to do what we can to work through our partners in the community, the leaders in those communities, and our messaging to get information out to try to help people understand the importance of the vaccine and the safety of the vaccine, and we'll continue to do that. The other thing that we'll be doing over the next couple of weeks is continuing to try to have vaccination opportunities in those communities. I know that both of our hospital systems are looking at that as well, to make it more convenient and to encourage people to come out for vaccine. And if you haven't seen it already, Commissioner Leak also did a video as she got her vaccine and has done everything she can to encourage her community to be vaccinated as well. So we will continue to work on that. We know that's an issue for Mecklenburg County, but we are committed to doing everything we can to help people feel safe and to access the vaccine.
This is Caroline Hicks with WBTV. Atrium is having its first mass vaccination site at the Speedway this weekend. Is the county playing any role in that, or what are your thoughts on what that might do for the community in terms of speeding up the process?
Well, anytime you can get out a lot of vaccine, it's a good thing. So we appreciate the fact that Atrium is doing this. We've had multiple conversations with them. We're partnering with them in any way that we can be supportive of their efforts. Obviously, our hospital systems have more resources than the health department, and so we will encourage them any way we can to get vaccine out into the community. Obviously, both of our healthcare systems cover more than Mecklenburg County, so we recognize as well that anytime they have these types of events, there's likely to be individuals from multiple counties that participate in them. So we'll be watching carefully, and hopefully we'll see a number of Mecklenburg County residents vaccinated this weekend in groups 1 and 2.
This is Derek with Fox 46. I have a question in regards to schools. We've seen CMS delay, and they're delaying for 3 weeks. There's a question as to whether you feel it would be enough. In addition to that, there are some school systems, specifically outside the Charlotte area, that are already starting to put in their school calendars and make their school calendars for the 2021-2022 school year. And this is despite the fact that this is still a very fluid situation, and a lot of things are saying it's probably going to be after school is expected to start this coming next year, that everything's going to be at least somewhat back to normal. Any advice for any school system or any school, particularly within the county, or for that matter, CMS, as they plan forward on this stuff? What exactly do they need to be taking into account here? And do you feel that this is going to be playing a factor in those school calendar decisions?
Oh, that's a great question, and one that is ongoing discussions with our school system. We've watched what other school systems have done, but the main thing for us is continuing to watch the situation in our community and continuing to work with our schools to make sure that they are well prepared to bring children back in when the time is right. The other thing that we'll be looking at closely as soon as we can is what we can do to start getting our teachers vaccinated. We think that will help as well. But we are committed as a department to doing everything we can to move our community to a place where our children can be back in school, because we recognize the importance of that. So again, it's as we've said with everything else, unfortunately, throughout this entire pandemic, it's a fluid situation, and we have to watch what's going on in our community, and we will continue to advise and be a partner with our school system as decisions are made.
Any further questions?
Gibbie, it's Allison again from The Observer. Could you talk about staffing at the hospitals and what Atrium and Novant are reporting as far as any doctors, nurses, other healthcare workers out, and if you're experiencing any similar challenges at public health of folks having to quarantine or isolate?
The latest that I've heard from both hospital systems, which was earlier today, is that they're fairly stable with the number of staff who are out for isolation and quarantine. So that number's not going up, which is a good thing. I'm sure they would like to see that come down, but as they're getting more and more of their teammates vaccinated, hopefully that will help. We continue to see a few cases from time to time in our department, but you would expect that across the board because people are out and about in the community. So again, just recommending that people do not get out and be in places of gathering any more than they have to, so that we can keep those numbers down in any business, including the health department.
Any further questions? Thank you all.
Thank you very much for being here this afternoon.
Thank you.